Do you know what is mononeuropathy? Well, if a single nerve is damaged or diseased, it is known as a mononeuropathy. What is the most common cause of mononeuropathy, especially in the upper limb of the body? Well, that is the carpal tunnel syndrome. What is the carpal tunnel syndrome? So, carpal tunnel syndrome, also known as entrapment neuropathy, is when one of the major nerves of the hand, that is the median nerve, gets compressed under a fibrous band known as the transverse carpal ligament. So, median nerve controls the movement and gives sensation to the thumb, the first or the index finger, the middle finger, and half of the ring finger. So, when the median nerve gets compressed, it will lead to the carpal tunnel syndrome. So, a patient of carpal tunnel syndrome can experience an irritable electric sensation in the palm, in the thumb, in the index finger, in the middle finger, and part of the ring finger. Also, the patient can experience tingling or numbness in the hand. There can be a sensation of pins and needles in the hand. There can be weakness in the hand. In long-standing or severe cases, there can be atrophy of the muscles, especially below the thumb, and that leads to atrophy of the thenar eminence. A typical presentation is the pain of carpal tunnel syndrome gets worsened at night because mostly people tend to flex their wrist while sleeping, and as a result, this puts pressure on the median nerve and will lead to worsening of symptoms and pain. So what are the common causes and risk factors of carpal tunnel syndrome? Number 1 being age. As you grow older, you are at high risk of getting carpal tunnel syndrome. Then gender. Females are more prone than males and especially seen in pregnant females. Then certain health conditions like hypothyroidism, diabetes, acromegaly, amyloidosis, obesity are all more prone of getting carpal tunnel syndrome in lifetime. Also, traumatic conditions and fractures, then arthritis like rheumatoid arthritis. People who are doing repetitive hand movements, especially movements like typing or working on the computer and using the mouse, are more prone to developing carpal tunnel syndrome. So what are the treatment modalities of carpal tunnel syndrome? Well, it can be either conservative or non-surgical techniques or surgery in cases of severe carpal tunnel syndrome. So it is very important for you to contact your doctor or healthcare provider if you experience any of the symptoms of carpal tunnel syndrome, because in case you neglect them, it can lead to permanent nerve damage.